So welcome everybody. Thank you for joining this Swiss Digital Days session hosted by Impact Hub Basel, where we're going to provide some digital case studies from one of the programs that we work on in Romania. The program is called Innovators for Children. I'll just give you a quick introduction and then I'll pass over to our two speakers today who are going to tell you a little bit more about what they are working on, their projects, their startups, and then there'll be time for some question and answers from the audience. So firstly, what is Impact Hub? Well, Impact Hub is the world's largest network focusing on building entrepreneurial communities for impact at scale. There are over 100 impact hubs around the world in different cities, and our purpose is to make a positive impact in the world by supporting purpose-driven individuals. And what that means in practice is we support entrepreneurs and members of the community and with training sessions and events. We also run incubator and accelerator programs and operate co-working spaces for our members. In Switzerland, there are 6 impact hubs in the following cities. And joining Impact Hub in Switzerland will give you access to more than 1,700 members across the country and over 17,000 members worldwide as part of the Impact Hub community. We're guided by the United Nations Sustainable Development Goals. Different impact hubs focus on different goals within this framework, and here at Impact Hub Basel, we focus on goals 3, 4, 5, 11, and 12. There's good health and well-being, quality education, gender equality, sustainable cities, and responsible consumption. The Innovators for Children program is a collaborative effort between Impact Hub Basel and Impact Hub Bucharest in Romania and Fondation Botnar. It's a 2-phase incubation program for early-stage tech startups aiming to improve the health and well-being of children and adolescents in Romania. And as part of the program, startups receive training and mentoring and connections into local and international entrepreneurial communities, as well as access to funding of up to 100,000 euros. Ultimately, we're aiming to bring impactful, innovative, and scalable solutions to the market. As I said, the program operates in 2 phases. In phase 1, we typically have 130 applications or more each year, and from those, 11 or 12 startups are selected to take part in the validation phase, where they work on developing their business model. At the end of phase 1, they take part in a pitch day, and the winners of the pitch day, 4 or 5 winners, go on to receive a share of 100,000 euros in funding and access to phase 2, which is the in-depth development phase, which lasts for 6 months. And we're very pleased to be joined today by 2 of the winners from the 2nd edition of the program, which is currently running. So they're currently in the in-depth development phase of the program. There's Adela from Emoface, who's developing interactive avatars to help autistic children recognize emotions and develop social skills. And then Christina from Peditel, which is a child-focused telemedicine solution aiming to improve access to pediatric healthcare. I'm now going to hand over to Adela, who's going to tell you more about Emoface.
Yes, thanks, Adam. Okay, so my name is Adela. I will present, hopefully very shortly, our startup, which is called Emoface. So what we propose is a kit of educational mobile games, which will help individuals to learn emotions and to develop their social skills. This is a spin-off from the Grenoble University in France. I participated in the Impact Hub in Bucharest because I'm Romanian and I did my bachelor studies in Romania. And Emoface in itself is, let's say, it's a collaboration, Romania and France. And what we present is a set of digital tools that help users interact with 3D avatars in order to develop their social skills. And the idea is that these avatars are piloted by an artificial intelligence that renders them expressive and makes them capable of expressing emotions. Okay, so in our team, I will shortly present our team. So I am the CEO. I have a PhD in computer science, and the origin of the project is based in my studies on how people actually express their emotions and how we can model this statistically in order to generate 3D animations that are capable of expressing emotions. My associate is Mayra Lima, and she's a designer, UX designer, and she has a lot of experience in designing products for children with autism. And we also have a speech therapist that is specialized in autism. This is because our first target be to look at how to teach children with autism, help teach them to express and better manage their emotions. We also have a scientific committee, and we are working with specialists and researchers in learning methodologies for autism, and also specialists in computational cognition and computer graphics. So to express why we started this, it's because we noticed that so autism touches 1% of the total population. That means more than 3 million people in Europe. And one way of characterizing autism is certain difficulties in the social cognition, especially in social interactions. Because of this, many people on the autism spectrum have difficulties in the social inclusion, and this leads to more than 30% of kids being out of school and more than 90% of the adults being unemployed. And for instance, this will require they will be accompanied by the state. For instance, in France, they will be accompanied, and this costs the state more than 7 billion euros a year. And the way that they are accompanied is by working with specialists and being in certain kinds of institutions where they will have to learn different types of skills. And for instance, the way that specialists work, in order to learn a new emotion, they will start with pictures and images. These specialists are usually psychologists or speech therapists. So they will start with pictures of that emotion in order to explain what it means, in what kind of contexts it can happen, and how it can be expressed. Then, if this exists, they will be included in social skills groups where they will try to simulate certain situations, and then they will have to deal with the actual situations themselves directly. What we notice is that there is a great lack of a lack of tools that help generalize this learning of emotions, because there is a huge gap between the visual support represented by still images and pictograms and what actually happens in the real life, where everything is very fast and everything is dynamic, everything is very different. So what we propose here is a tool that is dynamic. So it uses a lot of 3D animations, videos, and speech. Content that is nuanced. So we talk also about complex emotions, about showing different intensities for each emotion. Then variety. We talk about personalization. and the actual variety of the expressed emotions and possible social situations that are illustrated. And in the end, interaction, which is very important for learning, which allows stimulation for a more efficient learning, and a real-time feedback, which better simulates what happens in the real life. So in order to do this, the technology that is at the core of our tool uses AI to generate emotional 3D animations. So for this, we started by recording emotions, by 3D capturing them, and with also capturing the voice. By analyzing all this data, we were able to create statistical models for each emotions in order to generate audiovisual features. This is then used to create 3D animations. And here I have an example for one phrase that was generated for 4 complex emotions. And I will play a video here.
Ce n'est pas possible. Ce n'est pas possible. Ce n'est pas possible. Ce n'est pas possible.
Okay, so what happens is that we use these emotions, these animations in different types of activities that are used specifically to simulate real situations and to help train. And in our first app, we have, at the moment, we have 6 avatars, the 6 basic emotions, and 3 different ways of training using this kind of 3D animations. So we have first a course with 30 levels, 15 exercises per level, where we start by learning and directing the attention towards the facial expressions. Then we associate them with actual emotions. We train their how to express, recognize, and manage them. And then we associate these with the different social situations in which they may occur. The actual activities. So we actually have 5 types of activities that are also used separately in a section called games, where a specialist can actually do a very low-level configuration where you can choose exactly what kind of emotions will be trained, with what level of difficulty, and what kind of skills will be trained. For instance, by doing an activity that's called try to make pairs, we train the ability to differentiate between different expressions at the level of the face, or with another activity called do it yourself, we actually train the imitation. So we show one animated avatar and we ask the user to imitate it. And also there is one section called exploration, where the user will be able to play with expression at the level within the face of an avatar, and actually play with the intensity of that expression, going from neutral to very exaggerated. And by trying to make different kinds of combinations, they basically play around with them and they discover in a fun way. So our impact that we are measuring is on a short and middle term. We actually we are in the train of doing a clinical evaluation, in which we will in the social medical structures, where we will see exactly which kind of skills are trained, and then what is the impact at the autonomy and emotion management level. And then on a longer term, with the help of Impact Hub and Ronalpia, our partners for measuring the actual social impact, we will try to see what is our impact on the health and well-being, on the families and the children, and also for a longer impact, what is our effect on the social inclusion and employment. And I will go fast through the segments that we actually address. So we've noticed this in both in France and in Romania. What we'll do is that we'll first target liberal professionals. So these are speech therapists, psychologists, also teachers, specialized educators. That are our first, they are the early adopters that are very interested in finding digital tools that will give them, they will be complementary in their therapy sessions. Then we will look at structures, which usually have teams, multidisciplinary teams that follow the same group of children. And finally, we will look at families. There, the point is to ensure the continuity of the work that is started during therapy sessions to also be carried at home, because parents are very keen on finding new tools, especially for the social-emotional learning, which is very hard to do and hard to evaluate. They are also actively tools to do this kind of work at home. And this is a short description of the timeline that we've had until now. So the project started in, let's say, around 2012, when I started my research, and it actually started in 2016 as we were accompanied by an incubator in France. Since then, we've carried hundreds of tests in the presence of specialists and children in social medical structures, which allowed us to do 3 iterations of our first application. We've had in April, we started an open beta test in which more than 500 users have participated. This has allowed us to have a lot of feedback and very positive reactions to our app, especially for those who have been using it at home because of the confinement. And since then, we've been improving on this, and we are ready to launch commercially our first app in November. And this will be launched in French and in Romanian. And then starting January, we will have another program, research and development, which will allow us to develop the next modules, which involve more tools to help the specialists create their own 3D animations by adding voices, adding phrases, and even more emotions, and also body gestures. And as for what will happen, this is a short description of the types of products we propose for the next 3 years and the languages in which we will carry them. So after November, we'll have the launch in Romania in February 2021. And then we will also present it in Spanish, Portuguese, and of course in English. So thank you very much, and I am open to answering questions that you can, I guess you can ask here or write it in the room chat.
Yeah, we could also do the question and answers at the end after both the presentations.
Sure.
Then, yeah. So, yeah, perhaps we do it that way. So maybe if what people can be thinking about their questions, and then we'll have the Q&A session for both of our speakers at the end. So I'll pass over now to Christina.
Hello, I'm Christina. I'm from Romanian Parents Foundations. I'm located at the Cluj-Napoca, Transylvania. And before the presentation, Adam, I want to present some facts about Romanian rural medical system because we have about 2.2 million children under 18 years old. They are living in rural Romania. This figure represents about 46 of all the children in Romania. Rural Romania has only 4,600 family doctors, which represents 58 physicians for every 100,000 inhabitants. 600 countries have no doctor at all. Yeah, or drugstores exist only in half of the countries at national level. We have one hospital for every 56,000 inhabitants in Romania and one ambulance for 53,000 people. There are only 2,700 public and private ambulances, and only 65 of them in the countryside. We have the largest rate of mortality after childbirth in the European Union, 31 to 100,000 inhabitants, and also the largest rural mortality, 15.4, to correlated with the smallest percentage of the GDP spent for healthcare, about 5%. Also, 34% of the rural population in Romania is uninsured. So it's very difficult for the Romanian parents to have access to medical support or medical or pediatric at all. So in about 6 years ago, in 2014, we decided to have a solution to a problem in Romania. It's called PEDITEL 1791. And it's an international medical program for the children, for the Romanian citizen. They are living in Romania and the diaspora. And what is PEDITEL? It's a free pediatric medical assistance for the parents. It's a telemedicine because in this moment we have only a call center for the parents, and in March next year we will integrate it, the call center, the actual call center, with a chat, phone call, video call, integrated in a mobile app, and PEDITEL will be the first medical pediatric hub in Romania and maybe in Europe, I don't know. This technology will support will offer medical support for more than 150,000 children, Romanian and the diaspora. And we have free access, non-stop, 24 hours, 7 days, from anywhere and anytime for the parents. PEDITEL is a technological solution for the systemic problem in Romania, because the parents want to avoid panic and want to have pediatric or medical support all the time, not only in the shift for the family doctors. In Romania, we have the shift until 3, 4, or maximum 5 o'clock p.m. And after that, the parents are going in the AR. So it's very, very difficult for any parents from rural area or urban area to have access to a specialist. So a lot of parents are trying to solve this problem, questioning the internet source or social media groups, and that it's very dangerous for the health for their children. Next. So we have about one doctor in the urban area to 1,700 patients. So doctors are restricted for 20 consultations per day, and we don't have after-hours program. So a lot of rural communities are they have a distance between the hospital or pediatric system to parents, and it's about 30, 40 kilometers, and we have about 600 communities without doctor. So we want to have the solution or the medical support for all the children between newborn and 18th year old, and to support parents, because it's very difficult to have a sick child. It's the parents are very stressed, and a lot of panic for the Romanian parents. For about 6 years, we have 1 out of 5 children arriving in the AR in the pediatric hospital in the Romania. In the Romanian system, we have about 16 pediatric hospitals. So 1 of 5 children was already helped by the pediatric pediatric team from Peditel. From now, about more than 280,000 calls are from the parents from Romania and from diaspora, and this project it's free of charge for every parent from Romania and from diaspora also. So it's medical support 24 hours, 7 days per year. Our impact from now, from about 6 years for the activities to Peditel, it's more than 280,000.
Oh, we seem to have lost the connection with Christina. While we wait for her to come back, does anyone have any questions following up on Adela's presentation? Oh, Christina is back.
Okay.
Okay.
Okay. So we have about 31 calls are from the parents. They are living in the rural area, and 69% are from the parents. They are living in the urban area. We want to switch the percentage. So we want to have more than 70% from the rural area and 30% for the urban area, because our support is very important for the parents. They are living in the rural area and they don't have any medical support in about I don't know, 50, 80 kilometers around. In this moment, we have 1.5 shift, one doctor per shift, and we are about 6,000 calls per month. And in this period, with the pandemic period, we are trying to help a lot all the parents because they don't have access to AR or other medical system here in Romania, especially in the lockdown period. So in that period, we have about 8,000, 9,000 calls per month with 2 doctors per shift. Our team is about 15, 17 pediatrics and 1 or 2 maximum doctor per shift. Because we are located in Cluj, our support for the public system, it's very important because we have about 18% decrease in the number of representation of the AR in Cluj. And more than 16% decrease the number of the ambulances sent to possible emergencies. So it's very important to support the public system because we don't have pediatrics and we have problem with the family doctors. They are choosing to work in other countries in the European Union. So it's very our system, public medical system, has a lot of problem with the doctors. They are choosing to not practice here in Romania. In the future, we want to do the telemedicine. It's, I don't know, the future for the system, medical system, and access for all the people. I believe all over the world. So telemedicine makes medical assistance accessible and quite free sometimes. And I believe from the home comfort, one can get useful and safe medical information, avoiding information from the internet or social platform because they are dangerous for the health for the children. Peditel will be a medical hub integrated with video call, call center, and chat and medical file. And we are trying to bring another specialist like speech therapist, psychologist, gynecologist, and to have educational section to support families about develop and raising healthy their child. Every year, we want to have more than 250,000 children helped by our medical team. And our goal is to every 2 minutes, our doctors will offer pediatric medical advice free of charge 24 hours, 7 days per year. And in 6 years of activity, we have a lot of support for the parents. We have a small report for our activities about first year in 2014 until now. If Adam, you have the report, it's the increased course from the first year until last year. Our in 6 years we have more than this.
Is there a specific slide you wanted me to show here, Christina?
Yes, you have the course for, yeah. So in 2014, we have about more than 6,000, and in 2019, I believe our support is very, very important for now, and I believe Peditel is very helpful for all the parents all over the world.
Okay.
A lot of we have 5 medical problems for the parents. They are calling Peditel. The Romanian parents are scary about fever, so a lot of course are from for fever, diarrhea, vomiting, and cough. 5 medical problems, and more than 74% of all the calls, they are problems they are solving at home. It's not necessary to go in the pediatric or family doctor or AR or to call the ambulance. A lot of our calls are from Bucharest, Cluj, and other big city in Romania, like Timișoara, Iași, Craiova, or Constanța. But we are hoping to support more the parents they are living in the countryside, because our support, I believe, this will be more valuable for the parents. They don't have any medical support in their area or small cities, counties, or communities. They are disadvantaged because a lot of Romanian communities are here in Romania. A lot of them, they don't have any insurance, medical insurance, and they don't have access to a medical, to a pediatric or to medical support.
Thank you very much, Christina, and thank you, Adela, as well. Now going to invite the audience to ask any questions. There's already been a couple of questions in the chat. I think one question here, which was written to Adela, but I think it was to Christina. Yeah, you mentioned changing to rural areas. How do you plan to address infrastructure difficulties in rural areas?
We have in Romania very good internet, and a lot of rural parents, they have a smartphone. So I believe that telehealth will help the parents to access easier to pediatric using Peditel, because internet is quite very cheap and very good infrastructure.
Okay, there's another question here for Christina as well. For Peditel, how is it funded, and are the doctors volunteering?
No, our doctors isn't volunteering, so we are paying. It's very expensive project for our small NGO organization, and we are support Peditel by sponsorship, public financing, and a lot of parents they are donating for Peditel a small amount per month or per year. It's a private project. We don't have any financing from the government or the national house insurance here in Romania.
Okay. Are there any more questions at the moment? Let's see. No. Oh, one here. Adela, how has COVID-19 impacted your business?
In our case, we wanted to launch our first app in April. The 2nd of April is the International Day for Autism. And it was exactly during the lockdown in France. So what we did in the end was we let open a free beta version that until now we've noticed more than 500 users that have installed it. Half of them are families, half of them are specialists. At the very beginning, all the structures had been closed, so it was quite hard for the specialists to use them because they didn't have the kids with them, but it was mostly families who could test better. For us, it was positive because in one way we felt that we could help people at that moment, because there is this is also implied helping the kids with managing their emotions, especially in a time where it was very unusual for them, which can generate a lot of crisis at home. Now, once again, we want to do the actual launch, and we find ourselves again in lockdown in France. We will see how this goes, but for the moment the structures are still open and the kids are going to school, so this should normally, until now it will be in normal conditions. So we will see how this happens during November.
Thank you. And maybe, I know we're reaching the end of our time, but maybe just to put that question quickly to, oh, there's another question here for Christina. There's a lot of demand for your service. Congrats for all your achievements so far. How are you scaling at the moment, and how do you plan to scale your service? What are the obstacles, challenges, issues in scaling?
We are integrated the call center with a mobile app, and for that it's very important for us to scale Peditel, because in this moment we are stuck here in Cluj, because the call center is in place only here, so it's impossible to have access to other pediatrics from Romania or for the pediatrics, Romanian pediatrics, who they are working in the group. We have in this moment two large companies here in Romania. One, the most important bank, the first bank here in Romania, and another company who choose to support and pay the doctors. And we have for IT companies, they are helping us to develop the IT infrastructure and to have 4 or 5 doctors per shift every day, 24/7. And in beginning with this year, we have a short number to have the small donation for the parents. We are hoping to have more, about the 50,000 euro every year. And another possibility for the parents to donate, like mobile application, Pago, or other small grants for international companies who are working in IT fields, like Adobe or other.
Wonderful. Thank you very much to both of our speakers today. I'm afraid we're out of time now on the session, so it's time to wrap up. But thank you to all of our participants. Thank you as well to anyone watching this back afterwards, watching the recording at a later date, because I know this recording will be made available afterwards. And I'd like to point out that anyone who wants another opportunity to interact with our speakers today and to meet some of the other startups that are taking part in the Innovators for Children program can also join a session that we're organizing on the 3rd of December as part of a day-long Impact Day at Impact Hub Basel. So thank you very much, and I wish you an excellent day.
Thank you very much for your invitation.
Thank you.
Thank you.